Welcome to Health Matters. Today's episode on the occasion of Oral Health Day focuses on 2 reasons to visit your friendly neighborhood dentist: halitosis or bad breath, and the much dreaded root canal treatments. We are going to have a freewheeling chat with our guest and expert today, Dr. Michelle de Lima Pereira. From Margao, Dr. Michelle is an alumnus of the Goa Dental College and a practicing private dentist for the last 10 years. She is a former executive committee member of the immediately previous St. Luke's Medical Guild. Dr. Michelle, thank you for coming on our show today. And to start with, what is Oral Health Day and what is the theme of the year?
So Oral Health Day is on the 20th of March, and this is a day that was set by the FDI. That is the global body representing the dental profession.
Okay.
The purpose of this day was to increase awareness and to encourage the public to take care of their oral health, because right now with the lifestyle, it's becoming more of an epidemic, and almost every individual at some point in their life needs to visit a dentist with some oral condition or another.
Okay.
The theme for this year's Oral Health Day is Act on Mouth Health. So very often people, they realize they have a condition in their mouth, but they ignore it. So basically it's laying emphasis that prevention is better than cure. Act earlier rather than later.
Okay.
And Oral Health Day was set on the 20th of March. The reason they came up with this date was it was a combination of the 20 milk teeth and the 32 permanent teeth. So with a permutation of the digits, they came up with the date 20th of March.
Okay. Now, apart from smoking that we know does have effects, how does our lifestyle affect our teeth?
About lifestyle changes. So today people are taking a lot of fast food, ready to eat foods, frozen foods. A balanced diet is not very common now.
Okay.
I ran a little experiment yesterday to demonstrate to you what aerated drinks can do. So aerated drinks are very high in sugar. I poured the cola drink from this bottle into this jar.
Okay.
First of all, I would like to show you how much sugar is there actually in this cola drink. I measured it out, and that is actually, if you see, it's up to there. The level, yeah, almost a third of the bottle is actually sugar. Okay. Now, I placed an egg overnight in this drink, and an eggshell is got very similar properties to a tooth in terms of its calcification.
Okay.
So, if you see the egg just being overnight in the cola drink, it has cracks, it has demineralized, as compared to the portion that was not in the drink. So this is the same effect that all sugar foods have on our teeth.
Okay.
So they demineralize the teeth, and eventually it leads to dental caries and all sorts of oral health problems.
And brushing immediately after having it doesn't help?
It does, but too much of brushing also is not good for the teeth because it abrades the teeth. So naturally the solution is to reduce the amount of drinks, but of course brushing it off, because sugar does stick to the teeth, and that's when the bacteria in the mouth, they thrive on the sugar, and they release acids, which are the primary cause for dental caries in the mouth.
Okay. Now the first of our topics of discussion today is one that's quite difficult to handle, both for the person that has the condition as well as for people around, and that is halitosis or bad breath.
Right.
I think it's sometimes more difficult not for the person who has it, but for people around them, because they actually experience it. And it's a subject that, like body odor, is very sensitive, and it's extremely difficult to make the carrier aware of it because of social implications.
Right.
So first, how can one check for whether one has bad breath themselves? Because if you're used to a certain kind of smell, it doesn't seem out of the ordinary. Right? So recognizing that you have a condition itself becomes a challenge.
Right. Okay. As you said, you're absolutely correct. The incidence of halitosis now is very high. It's 1 in every 4 people.
Oh, that high?
Yeah.
Okay.
And it is also the 3rd most common complaint that presents in a dental office after caries or gum disease.
Okay.
So a lot of people are aware that they have bad breath. Now, how do you come to know that you have bad breath? The most common way would be is to ask a loved one this thing, because it is very obvious. But not everybody is comfortable doing that. So there are a few tests that you can do by yourself to show. One is that you can lick the inner part of your wrist, let the saliva dry, and then smell. So if there was any compounds on your tongue or this thing that is causing bad breath, you will be able to smell it on your wrist. You can also take a gauze and wipe it to the back of your tongue and then smell it.
Okay.
Professionally, there are also instruments like a Hallie Meter. A Hallie Meter is similar like you have your alcometer.
Yes.
It basically is like a breath analyzer, and it measures parts per billion of the sulfur compounds on your breath. So hydrogen sulfide is the primary compound responsible for bad breath.
Okay.
But bad breath is caused by so many different reasons. And of course, the most common being poor oral hygiene.
Okay.
So it is recommended that other than brushing and flossing, which everybody should do, they should also go for regular checkups and cleaning, professional cleanings to a dentist, especially those who are more prone to bad breath. Now, bad breath causes can be both systemic and local. Okay. Now, coming to the local causes, they can be food stuck between your teeth. There can be, dental caries in your mouth. It could be just bad hygiene, that you have plaque on your teeth. So plaque is laden with bacteria.
Okay.
It could be just on your tongue, that you're not properly cleaning your tongue. So it's very important when you brush your teeth to also clean your tongue. Yeah, because the tongue also harbors a lot of bacteria and is responsible for bad breath. There are systemic conditions, like if you have a blocked bowel or you have a gastric reflux, that also can reflect on your breath. So obviously the cure for that will be to take care of the internal conditions. Yeah. There are some drugs that cause dry mouth, and dry mouth is also responsible for bad breath. So people who are on treatment for cancer, or there are certain tranquilizers and all that can cause bad breath. So that can cause dry mouth. So that also can lead to bad breath. Then things like alcohol, smoking, these are known causes of bad breath.
Okay. Now you talked about dry mouth. So does keeping the mouth hydrated at all points in time help?
See, saliva is the most natural form of antibacterial activity in your mouth. So if the saliva is not adequate, which could be, as I said, due to many reasons, there are ways of, so sometimes even chewing sugar-free chewing gum, it has a substance called xylitol that stimulates saliva production.
Okay.
Yeah, so that can help. Using a mouthwash. So a mouthwash has got antibacterial agents. So, and of course, yes, hydrating yourself regularly also does help.
Okay.
But nothing like stimulating saliva production from your glands.
Okay. Now, the second subject of our focus today is root canal treatments. Now, to most people who've never had to deal with one, it's an area of mystery. People associate it with pain and with unwanted time in a dentist's chair. So, firstly, what is a root canal treatment? Okay.
So if you see this model, first let's understand a little bit about the tooth. So the tooth has got 3 layers. That's enamel.
Yeah.
Then the yellow part that you can see is dentine. And inside is pulp, where is your nerves, your blood vessels.
Okay.
So at what point do you actually need a root canal is when your pulp is irritated. So either your cavity has spread up to the pulp, or because of trauma you have fractured the tooth and all, and the pulp is exposed and is inflamed.
Okay.
And that's where your nerve and all is, which is why the throbbing pain and that most people associate when they need a root canal. Yeah. Root canals nowadays are fairly painless because there are local anesthetics and drugs that we can use to relieve the patient of pain.
Okay.
But people still have that fear of the days bygone that it is a painful treatment, and most of the time walk into our dental office with a lot of fear.
Trepidation.
Yeah, so yeah, that's something that we have been able to make as painless as possible now.
Okay.
Yeah. So what is a root canal treatment? So basically once the pulp is inflamed, depending on the severity of inflammation, sometimes you can even have an abscess which is at the apex of the root.
Okay.
Now there is no way for this abscess to drain. So which is why very often they present with sharp pain, and if it ignored for a long time, sometimes even a swelling.
Okay.
These kind of symptoms. It's very tender.
Okay.
Yeah. So the purpose of a root canal first is to establish drainage, and then once the infection is cleared, to prevent the same tooth from getting infected again in the future. Okay. So what we do is basically we clean out the canal, we decontaminate it completely, And then we fill it up to the apex with an inert material to prevent further microbial invasion of the tooth in the future.
Okay.
But but this cannot be done usually in a single sitting. The reason being, sometimes it takes 2, 3, 4 sittings. People wonder why is it. So it's all based on the degree of infection.
Okay.
So we cannot put the filling until the infection clears out.
Okay.
So at every sitting, that we'd either put a dressing, and we clean out and disinfect the canal even further until the infection is completely cleared out, and then we go ahead with the filling of the.
Okay. So I'll come back to that, to the procedure that one undergoes as part of the treatment. But to start at the beginning, what are the symptoms? You talked about pain and something else. I forget. You mentioned
sometimes
two
swelling,
things. Swelling,
tenderness.
Yes. Yeah. So what are there any other symptoms that might point to one needing a root canal treatment?
Yeah, a sharp shooting pain is always. So when you tap the tooth, we call it tender to percussion. So when you tap the tooth, it will be invariably painful. Yes.
Okay.
Of course, professionally, there are other ways of diagnosing. I diagnose it. We can use radiographs. There are so many ways of diagnosing it. But a person who knows, once the pain starts continuously, and almost invariably, it is a cavity that is heading for a root canal.
Okay. When does it become necessary to treat the root canal to go all the way down?
See, if this is why we were focusing on prevention is better than cure. If you had taken care of your cavity before it actually reached the pulp, you would have never needed a root canal. But unfortunately, most people ignore it until they are in pain, which is the stage where they already need a root canal. Like many people can see that food is getting stuck in the tooth, there is a cavity, but since they are not in pain, they don't do anything about it. So once it reaches the root canal, the nerve is exposed, and that's the time it is naturally very painful.
Yes.
Yeah. So one thing is you can prevent it by taking care of your cavity much early on. Some indications of root canal can also be because of traumatic injury, like a road accident where you've broken your teeth. In those cases, you have to go immediately for a root canal. A root canal therapy. So basically, like infection in any part of your body, you have to take care of.
Yeah.
The infection in the tooth also, this is the way of taking care of. The only way we can access drainage and save the tooth
is going on.
The other way is actually extracting the tooth, but you are losing a tooth.
Right.
So, but if you want to save the tooth, which we always would want to, it's through a root canal therapy.
Okay. Now, how is the treatment done? What is the procedure? How many sittings does it take?
Yes.
What happens in
So,
each sitting?
if you look at this model, if you see the nerve and the blood vessel, each tooth, it enters through this canal.
Okay.
So, basically, we will clean out the canal till the apex. So, that means that even the nerve and the blood vessel up to the apex is removed.
Okay.
So, the tooth actually becomes dead. Okay, so the reason is, if the pulp is completely inflamed, so we need to completely decontaminate this canal before we can put any filling.
Okay.
So in the first sitting, usually we would just relieve the patient of the pain and actually start with the decontamination process.
Okay.
We would wait for the infection to clear. So periodically we would check the patient. If there is still any infection, then we would give another dressing, call again, which is why the number of sittings can vary based on how severe the infection actually is. Yeah, and once we are certain that the infection is completely cleared out, in a completely sterile manner, we will put it with an inert filling so that in future it does not get infected again.
Okay. Now, what is a crown?
Yeah, so as I explained, the tooth is dead once you do a root canal therapy.
Okay.
And as we know, anything that is dead with time gets weak.
Yes.
And your teeth are undergoing a lot of forces for eating. So there is a chance in the future, as it gets weaker, that it will be brittle and just fracture. And all your root canal therapy, everything will go into vain and you will lose the tooth. So the purpose of putting the crown is to fortify the tooth. It bears the loads on the teeth with time as it gets weaker. So basically it's just fortification of the tooth.
Okay.
That is the primary purpose of putting a crown after root canal therapy.
Okay. And what are the kinds of crowns and what do they cost approximately?
Okay, there are many types of materials used for crowns. So some are cosmetic in nature. because just people who are conscious of aesthetics. And some are, they're made of materials like stainless steel and all, which are not necessarily tooth colored.
Okay.
So I would say the price range can range anywhere from 3,000 rupees to maybe even 15,000 rupees.
Okay.
The most expensive kind would be a precious metal one, which
Okay.
is made of gold, and that is subject to the day's rate of gold at the time.
Okay.
Yeah. Then you have metal ones, you have metal-free ones, you have ceramic fused to metal.
Okay.
Yeah. So based on what material is being used, the cost can vary.
Are there any amongst all of these that are more advisable than others?
So from an
Or more
economic
common?
perspective, the most common one is the ceramic fused to metal. So
Okay.
metal gives it strength and the ceramic gives it aesthetics. With the
Okay.
ceramic you can match to the color of the... So
Right.
that is, I would say, is the most popular
Choice
kind of crown
for-
that patients usually go
Okay.
for. You do have materials like zirconia and all that are strong and metal free.
Okay.
So they're very cosmetic, but they're also very expensive. So
Okay.
it's not in everybody's
So
reach.
ceramic fused to metal does not...
You do not see the metal's underneath.
Okay. What are the possible complications of neglecting oral hygiene?
Okay, there are a lot of complications. Now, there can be local complications. As I said, if you neglect a cavity, it can
Yes.
lead to a root canal therapy, it can lead to a space infection, all sorts of complications. And then there are a lot of studies have shown there are a lot of systemic complications that are related to bad oral hygiene as well.
Okay.
Anything that we put in our stomachs is going through our mouth first. So if we have a bacteria-ridden mouth, it is bound to enter our system.
Digestive system, yeah.
So it has been proven that the coronary heart disease is associated with periodontal condition.
Okay.
So studies have shown that the bacteria through the blood vessels in the gums can enter your circulatory system and be a contributing factor for coronary heart disease. A recent study has shown even Alzheimer's to be associated with bad oral hygiene. The study has shown that most people who have had Alzheimer's have never been to a dentist or really visit a
really?
dentist. And there are studies going on that are showing correlation between bad
One
oral
and the
health
other.
and likewise, even your respiratory system can get affected. Your alimentary canal can get affected. There is a strong correlation shown between diabetes and gum disease. So a lot of systemic conditions, they have, bad oral hygiene has been proven to be a contributing factor, yes.
Okay.
Of course, oral cancer,
As
that
well.
is, yeah, like there are so many carcinogens that are proven, like tobacco and pan chewing, and
Yes.
which is very common in India especially.
Okay. So doctor, what are some of the ways of avoiding poor oral hygiene and actually taking care to ensure that we're doing the right thing?
Yes, very important question. A lot of people do not actually know the correct way how to look after their mouths. So generally when we get up in the morning, our tendency would be to pick up the brush, just scrub it clean and go off to work and whatever. But this is not the correct technique of brushing. So it is recommended that you brush your teeth twice a day with a soft to medium bristle brush. And the correct technique is what we call a modified Bausch technique. So what you need to do is you need to hold the brush at a 45 degrees angle, 3 teeth at a time, partly on the gums, partly on the teeth. And you
Okay.
do small circular motions in a direction away from the gums. So if you're doing the top teeth, you will go downwards. If you're doing the bottom teeth, you will go upwards. So likewise, you go around the mouth 3 teeth at a time. And then, of course, the occlusal surfaces of the teeth and the lingual and palatal surfaces of the teeth, which is most often than not forgotten.
Yes.
The reason this technique is very efficient is we tend not to massage our gums, which is very important. So this technique of brushing not only cleans the teeth, but also massages the gums.
Okay.
And more often than not, the brush at the back always has a surface like this, which is corrugated. This is meant for cleaning the tongue, which almost everybody does not do.
Okay.
So you could either use the back of your brush or you get tongue cleaners, but it's very important to clean the tongue as well, because the fissures in your tongue also do harbor a lot of microorganisms. In addition to that, it is important to also floss. people have a habit of using a toothpick, which is very bad.
Okay.
A floss is designed to slide very easily in between the teeth, and any food that is stuck there, it will remove. And food stuck between the teeth is the biggest factor contributing to bad breath, because it's rotting in between your teeth. In addition to that, you can use a mouthwash. A mouthwash is an antimicrobial agent. Generally, we would prefer an alcohol-free mouthwash, and you would use that. But there are different kinds of mouthwash. Some that need to be prescribed by dentists, and some that can be used on a regular basis. Your dentist will be in a best position to advise you what is good for you, based on your oral hygiene. Twice a day brushing is adequate. You don't need to brush after every meal, but it is important to brush in the morning and in the night. Periodic visits to the dentist, at least twice a year, but we would suggest every 3 to 4 months.
Okay.
If required, if you are prone to plaque formation, and a cleaning at every time you visit the dentist is also recommended. If you're a smoker or you have any habits that contribute to poor oral hygiene, it's better to go and get the cleaning done at a dentist every few months.
Okay.
Yeah, and this is basically home care that you can do, and beyond that, it's up to the dentist.
Okay. Is there anything that you would like to say specifically to our viewers?
Yes, certainly. Emphasizing on the theme, act on mouth health, I would like to say time heals everything but not dental cavities. So unless you actually go to a dentist and get your dental cavities sorted, it's not going to heal by itself. So I would encourage everybody to actually take action and look after your oral hygiene and your mouth for better health and overall well-being. Thank you.
Thank you, Dr. Michelle, for educating us on these two areas, halitosis and root canal treatments. And thanks to all of you who are watching. We hope this has been an edifying episode and that you will be able to better handle issues related to good and safe dental practices in future.